My name's Becky Korinek, and I'm with a small local company called Outreach Patient Advocates. We're the only independent patient advocate company here in Omaha. What that means is if you go to the hospital, they might have an advocate for you. Great. Perhaps your insurance company has an advocate, but we are independent patient advocates, which means we only care about our clients. My best friend, Nikki Wick, started this company 4 years ago. He had been in the back end of medical management out at MD West 1, doing billing, transcription, insurance, all of that. She started taking her dad to the doctor, and she noticed that they were dropping the ball. And she thought, wow, if I really know what I'm talking about, because, she's got all the lingo, and they're still dropping the ball, what about people who don't know what they're talking about? Or people who don't have anybody to advocate for them. So she got certified as a board certified patient advocate, and she opened this company. And we work with seniors primarily. Most of our clients either never had kids or their kids do not live in the state. What we do is we sit down with you, we figure out what your needs are, what's going on. We fill out this binder which has all of your health information, every operation you've had, where you had it, who did it. My mom has 2 new hips. She doesn't remember which one she got done where. We're not the best historians, it turns out, especially when you go to the doctor, you're not feeling great. We also have a comprehensive medication list in here. The dynamic, really a living document. When you try a medication and perhaps it doesn't work or they have to make a change, we put that in red on your medication list and then we fax it to all of your providers because doctors do not get paid to talk to each other. We really look at your provider, and by the way, I've had asthma my whole life. I had a 3-level fusion a couple years ago. I love doctors and nurses, but everybody makes mistakes, okay? Everybody is human. And we don't want that mistake to be part of your life. What we do is we just make sure that all of the information is there for your provider. We look at them as kind of a detective, and we want to make sure that we are giving them all the clues that they need to solve the mystery of whatever's going on. And we tell our clients, if you have a doctor's appointment, you need to prepare for that appointment as though it was an appointment with your attorney. You would have every T crossed, you'd have all your paperwork. Well, when you go to the doctor, you need to be prepared in the same way. If you go to the GI, you better have a couple weeks worth of what have you been eating? How are your BMs? How much water are you drinking? Because otherwise, it's really a waste of time and money. We talk to our clients a lot about how to prepare for that appointment, and then we go with them. Maybe you only need us to go to one appointment, or maybe everything's falling apart and you need us to go to every appointment. We have a client whose children live in Colorado. She lives here. We really only check on her every day. We have non-medical care companion services in our company as well. But then that's kind of one end of the spectrum. And then at the other end, we have a gal who has a solid 5 appointments every week. She has a very complex medical condition, lots of balls in the air, and a lot to keep track of. So we take those copious notes at the appointment, we transcribe them, and then if there is family with whom we need to communicate, we do that. In addition to that, we keep all those notes right here in this binder, and the physician can just flip through this. Is there an MRI the physician needs to look at? It's right here. We want to make it easy for them. We don't want them to say, oh man, I don't have time to look at that. I would love to talk to you more about it. Thanks again for coming out today.